Today, we're going to be talking about the latest in skin hydration and dermal fillers, how to remove them, and should men be having them? Hello TLCers, welcome to another video. Here I am today in my tropical gear because it's summery outside. I'm here today to talk about a very hydrating skincare product. So over to our first segment. I'm not getting paid to say this. Okay, so here it is. This is SkinCeuticals HA Intensifier. HA stands for Hyaluronic Acid, and this is something that I've been using for a few months now since it was introduced into the UK. I'm using it once a day after my vitamin C serum in the morning, and I noticed a difference in my skin after maybe 3 or 4 days, which is pretty spectacular. So it's got 4 ingredients in it, which are quite exciting. Well, actually, the first one's not that exciting because it's just hyaluronic acid, and most things have got that in now, but nevertheless, hyaluronic acid. It's also got proxylane in it, which the Americans would pronounce proxylane, which I really love saying like that, which increases your native hyaluronic acid content, and in this product it increases it by about 30%, which is obviously fantastic. It also has licorice root extract, which contains dipotassium glycosyrate, which is a very powerful antioxidant. And it also inhibits melanin formation. So anybody who has maybe some melasma or some brown spots on the skin from perhaps sun damage, it would be good for that. It's also good for people with acne and rosacea because it's very anti-inflammatory as well. And the last thing is purple rice extract, which contains anthocyanine. Again, another very powerful antioxidant, which inhibits anything which might be bad for the skin. So it inhibits the enzyme which breaks down collagen, the enzyme that breaks down elastin, the enzyme that breaks down hyaluronic acid as well. So all those things together add up to something being pretty good for you to use. It's also paraben and dye free for all of you out there who care about such things. And yeah, it's something that I think you could benefit from maybe having in your bathroom cabinet. Sometimes a dermal filler procedure doesn't go exactly how you might have hoped, for whatever reason that might be. But fortunately, there's usually something that you can do about it to remove the filler. I had a patient in recently who came in for a few other bits and pieces, but his lips literally entered the room before he did. And I knew that we would have to do something about that before we could do anything else. So I'm going to show you a picture of him before he had any correction done, and then I'll show you how he looked after we did the correction. So as we can see here, the ratio of the lip is a little bit off. The upper lip ratio in relation to the lower lip is more than 50%. You can see that it's about 2/3 in the upper and then about 1/3 in the lower. And normally on a man, it will be either 50-50 or 1/3 in the upper and 2/3 in the lower. But it's not like that in his case. Also, you can see that there are little lumps and bumps in the outer 2/3 of the lip, just here and here, and lip filler shouldn't look like that. It should be really smooth and well integrated into the skin. He actually wanted to go bigger with his size. I find often when people say that, they don't mean they want to go bigger, they mean they want their lips to look better. And in this case, just adding more filler on top of a pre-existing problem is not going to make it look any better. You have to remove what's there in order to give you a smooth canvas to work from. If we add more filler where he's got lumps and bumps, those lumps and bumps are just going to get bigger and it's just going to look even worse. So we use an enzyme called hyaluronidase to break down the filler that's in there already. Now, hyaluronidase is something that you already have in your body because you've got hyaluronic acid, and your body is constantly making and breaking your own hyaluronic acid down. In fact, about 30 to 50% of your native hyaluronic acid is broken down every 24 hours with this enzyme. So what we do is we get the enzyme, which is from the pharmacy. It's a prescription only medicine, so you can't just buy it. You need to mix it with some lignocaine, which is local anaesthetic, the same as you have at the dentist, and that really takes the sting off it. and then we just inject it where the problem is. So as you can see, we're just injecting right now into the areas where he's got those few little lumps and bumps. Interestingly, if you put hyaluronidase directly onto dermal filler, it will break it down super quickly, like literally within a few seconds to minutes. It just turns into like a watery solution. In the skin, it takes a little bit longer because when you add the local anesthetic hyaluronidase mix to the skin, it swells up, and it swells for maybe around maybe 24, 48 hours, something like this, just because you've put fluid into the skin. But after that, you go pretty much back to normal. So as you can see here, he's now got his ratio back. So the upper lip is now 1/3, the lower lip is now 2/3, which is great. That's how he is naturally. This is his natural lip shape because we literally took everything out. You can see that there's no more lumps and bumps in the lip anymore. It's all completely perfectly smooth, which is really exciting because then it makes it a lot easier for me to do a good job. It's very hard to do a good job if your canvas is imperfect. And we can see here the two pictures side by side. The before and after he had the hyaluronidase used. So here we've got all those horrible lumps and bumps. Here the lip is completely smooth again. Here the ratio is totally off, you know, it's like 2/3 on the top there at least. In the lower one, it's just the 1/3 with 2/3 on the bottom. And that's exactly what we want to see before we go on and do any other procedures, which is actually what we did next. We filled his lips. I'm going to use what's called a cannula to do that, which is a blunt-ended needle. So we make a small needle point next to the lip, and from that one point we can then access the upper and lower lip just from one hole. It's really good because it means that you don't have to keep going in and out with a needle, so you're much less likely to get swelling. And it gives you a slightly different sort of result as well. So it doesn't sort of give much definition of the border of the lip, but it does increase the volume of the pink part of the lip, which I think on a guy can look quite attractive. And obviously, if you've got to go to work the next day, then having less swelling is a bonus. Now we answer that age-old question. Should men have lip filler? Well, newsflash, because a lot of them already have. If you look at Glamour magazine's top 3 sexiest men 2017, that's Jamie Dornan, Aidan Turner and Robert Pattinson, you'll see that they all have quite full sensuous lips. And in the Journal of Plastic Reconstructive and Aesthetic Surgery 2015, somebody called Penner wrote an article about how it was very, very important for the attractiveness of a man to have a full upper lip. He mentioned specifically the upper lip. So what that means is if you're going to have a full upper lip, you also need to have a full lower lip as well to keep everything in proportion. So if you recall, the proportions are supposed to be 1/3 to 2/3 upper to lower lip ratio, or 50-50. You can have either, really. I think in a man, it's more reasonable to have 50-50, but you still see examples of 1/3 to 2/3. To answer the question, should men get lip fillers, I think it's clear that the evidence shows a larger lip is perceived as being more attractive. So if you're a guy who's maybe thinking, oh, what can I do to make myself look more attractive? Or if it's already clear to you that your lip is quite thin, then dermal fillers might be something that you consider having done. Yeah, why not? So that's it for this week. Please like, comment and subscribe. And for more of the same, please come back next week.